Genetic tests are affordable and easily accessible, but how do you know that you're getting the right test for you? If you have a family history of health issues or just want to learn more about your own health, it's important to speak with your doctor about medical genetic testing. Here to tell us more about it is Dr. Robert Nussbaum, the Chief Medical Officer of Invitae. Welcome.
Thank you, Elsa. It's a pleasure to talk to you today.
Happy to have you here. So I want to start out with the basics. What exactly is the difference between recreational genetic testing and medical ones?
There are really three big differences. Recreational testing is quite explicitly not to be used for any kind of medical decision making. You should not be undertaking any medical procedures or anything else involving your health on the basis of a direct-to-consumer recreational test. Number two is comprehensiveness. The direct-to-consumer tests are really very hit or miss. I mean, for example, suppose you wanted to spell check an entire chapter of a book. The medical genetic test looks at every line, every word, every letter to see whether there's a misspelling. But the direct-to-consumer testing only pick 2 or 3 words and ask, are those words misspelled, ignoring all the rest of the potential problems in the rest of the genetic code, which could be important for your health, but is simply not looked at and not reported on. And the third big difference is when someone comes to Invitae to have a medical genetic test done, we immediately hook them up with a professional in genetics, either a physician or genetic counselor, who makes sure that they're ordering the right test and then helps them, follows them through their entire journey so that they get the kind of support and advice that they need to go to the next steps once they've had their test result. We don't just leave them hanging with a result and say, go talk to your doctor.
Got it. So the real limitations of the recreational tests are that they're not really comprehensive. It's sort of just an overview then.
It's not even an overview. It's a really very specific questions about a very small fraction of the total number of changes which could be important to your health.
Got it. Okay, so how can someone get a medical genetic test then?
Yes. So what we're announcing and what Invitae is undertaking is for the first time to make easily accessible to anyone in the public, to make accessible to them the same high-quality medical genetic testing that professionals, genetic counselors, physicians have had access to, have used, and have trusted for years from Invitae. And that's available through our website, invitae.com. Any member of the public can go there, start the process. We then help them decide what's the right test for them to answer the question that they're trying to ask.
So what specific tools are available online? Is it just getting this test, or are there questionnaires as well?
There's a questionnaire. Once you order the test, there's a questionnaire, a very simple, straightforward questionnaire, which helps us figure out what's the right test for you. Do you have a condition and you're trying to figure out whether there's a genetic basis for it? Are you simply looking to see whether you have genetic changes that put you at risk for something, but you don't have a personal or family history of this condition? Or perhaps you're going to the website because you want to know whether you're carrying something which doesn't cause you any health concerns, but if passed on to a child by you and your partner, could cause a very serious medical condition in your child. Well, that's what we call carrier testing. Okay. That's also available, and we're hoping that it's going to result in people getting carrier testing done at the appropriate time, which is before they undertake a pregnancy, when there's more options available.
And doctor, can you just give us that website one more time?
Yes, it's invitae.com,
right.
invitae.com.
All right, Dr. Nussbaum, thank you so much for your time today. Really appreciate it. And we'll be right back right after this. Stay tuned.